Welcome back to Medicare Agent IQ. I'm Raul Gonzalez.
And I'm Oscar Ibieta.
And so we're back. This is week 2 of really just kind of answering some questions, responding to agent questions that we have seen or we have received recently. And so this was a big one I wanted to just jump right into. And it says, I recently encountered a challenging situation and would love to get your perspective. Last year, I worked diligently to assist a client with their UHC needs. This year, however, they informed me that they'll be using their sister's agent instead. This decision has left me feeling quite frustrated, almost as if I've been fired, despite the effort I put in. How should I handle this situation professionally? And what steps can I take to prevent such occurrences in the future? So what I would like to do is answer the first question, how should I handle this situation professionally? And then we'll come back again and handle the other question about.
And this has happened to all of us, right? I'm pretty sure. I mean, I know it's happened to me. I know when you were out selling, it probably happened to you, and you can get in your feelings about it. You know, you feel like, gosh, I've worked so hard. I've walked them through the process. I explained everything to them only for them to give me a call and say, hey, we're going with somebody else.
Yeah, man, I had a situation where it was I remember this as vividly. It was a Friday around 3 p.m. and usually I do cut out a little early on Fridays. And I was there, and it was she called me, and so I was actually on my way home. Instead, I pulled over and I was basically helping her with a Medicare supplement over the phone. And so really kind of helping her narrow down which plan. We looked over several different carriers, and so we scheduled an appointment. I think it was for like Tuesday, and this was Friday. So we scheduled the appointment for Tuesday, and I found the plan that had the lowest cost, found the prescription drug plan. We were just going to go get together and do things in person. And, you know, especially since I'm sitting in the car. And this was before I was, this was about 5-6 years ago. So before I was really into, hey, let's just do it in Sunfire, knock it out. Yeah. This is part of why that I'm like, hey, let's just do it today, is because when we were on the phone that day, I went through all of the costs, and then I get an email from her on Saturday afternoon and says, hey, let's cancel our appointment for Tuesday. Thanks so much for the advice. I enrolled into the company. I think it was Mutual Omaha, into the company that you recommended, and I got my drug plan taken care of. Thanks so much. And I wrote her back and I said, hey, I'm, part of what I do is I'm the agent. I help people enroll in a plan. And her response was, don't take it personal, it's business. I'm like, well, basically you took money out of my pocket that I earned. And I was frustrated. And I think we've all felt that frustration. And I've coached you through some of this, right? Like how we should really respond in at the end of the day, my goal is that, for my kids to be proud of the way that I handle myself. Honestly, I'm not gonna show them that my feelings are hurt. I'm not gonna show them I'm kind of angry. I'm just gonna say, hey, look, I do want to let you know that I do get paid to enroll people into plans. I understand you decided to go with someone else, and completely understand that. Feel free to give me a call if the situation ever changes. Realistically, it's just part of the business. Unfortunately, you could be the best agent in the world, do everything for people, and they'll want to go with their best friend's agent because they want the approval of their best friend more than they want your approval.
Yeah, no, I recently had a very similar situation. I met with so this was actually a friend of mine who referred her dad to me, and her dad had reached out to me. I had missed his call, and I'm going to be real honest. I took a little while to respond to him, and the reason was,
put it all out there, Oscar.
Gosh, man, it was a week. It was a week. This is bad. And let me explain, right? I could sit here and say, it's the middle of AEP. I've been so busy. I've got a lot going on. Here's the reality. We're all busy. And right. We all have a lot going on. And so I can't blame anybody. I can't sit here. I'm not going to sit here and make excuses. It was my own fault because I should have gotten back to him immediately. But I kind of took it for granted, thinking, okay, this is a referral from a friend. This one is, I've got it in the bag. You know, I'll get to him. I've got a crazy week this week. I'll get to him, you know, next week, because I don't have a lot on the calendar when I can get back to this individual. So I did get back, and he says, Oscar, thank you so much for I left him a voicemail, and then I sent him a text message, and he responded to me via text, and I said, Oscar, thanks so much for reaching out. I already connected with another agent because I hadn't heard from you. And that just that hurt, right? I felt just the punch to the gut immediately. And I thought, wow, well, this is my own fault. So my response was, hey, I completely understand. I apologize that I took so long to get back to you. Please keep me in mind if things, you know, if you want to make sure that you're getting all the information that you need. I'm still here, and I'm still happy to sit down with you and explain everything to you. And then again, he responded, thanks, but I already got it taken care of with another agent. Another punch to the gut, right? And I said, okay, you know, and I just kind of had to take a step back and say, well, you know, this is my own fault, and I got to learn from this. And now I know, right? I cannot, even now, this late into my, 10 years into my career, I can't take these kinds of things for granted, and I need to be responsive immediately. But you got to learn from this, and you got to move on, right? I love what you said when you said, how would, I want to make sure that I'm setting the example and that my kids see how I respond to these, because I could have responded emotionally, and I could have said, gosh, well, I'm friends with your son. I want to be the one to help you, or I've been doing this a long time. I want to be able to sit down and have that conversation with you. Or I could have been even more negative about it, but I decided, you know what, I just need to take a step back, and I need to just respond professionally, and I need to move on from it.
I think like with that one, you kind of know that was my fault a little bit, right? But there's other situations where there's nothing that you could have done differently, right? They just wanted the approval of their cousin or their sister, whoever it was that told them to use their agent. Maybe they're that other person was super close with their agent. So you just got to move on from the situation. You just got to not take it personal on those. Don't take it personal. It is business, and just move on to the next. And there's things that I could do in the future that would have helped my situation. So for what I could have done differently is enrolled her that day. And, instead of setting an appointment when I already know what plan, I've already told her which plan I'm going to enroll her to, just go ahead and take care of it. Like it was probably, thinking about it, is Friday afternoon. I was probably ready to start my weekend, and I was like, well, let me just go ahead and take care of this on Monday now, or Tuesday, and now I've got to sell for the future, and that cost me. And so maybe I would have, that's what I could have done different in that situation. You could have called them back sooner,
right away,
not a week, right? But and I love that kind of, to me, it takes, we've got to get to a real vulnerable place here where we're just open and honest about where we fall short here. Also, Oscar makes recommendations to people every day. You got to make those phone calls, and this can happen to any of us. I think the greatest danger, and I think it would have been different if it wasn't a referral from your friend's dad. You would have probably called them back a lot sooner. So that's another lesson that we can learn, is maybe not feeling like there's, like, for anyone. And does your friend's dad deserve the highest level of service that Oscar has to give? He does.
Yes.
He really does, especially since it's your friend's dad. So if anything, now I'm feeling bad.
No,
here.
let's do it.
But
you gotta have these conversations.
Like if anyone deserves that best experience, it's your friend's dad. And so maybe if we think of it in that way, and I've had that situation happen to me where, like, I've left. So for us, it's like recruiting agents, right? Like this agent, they're really good, and I'm like, I'll just give them a call back on Monday, and they end up finding somebody else. It was kind of a funny story. There was an agent, and so I ran into him and his upline, who's actually, they're friends of mine. The other upline. They're friends of mine, and they were traveling to Las Vegas together, and we ran into each other at the airport. And the guy comes up to me, goes, "Hey, I know who you are." I was like, yeah. He's like, "I called you the day that I left my job as an ICA at United Healthcare. You didn't call me back, but I called I've said the name. You can blank out the name. But I called him and he called me back. So I figure you guys are all the same. I just called And so it was kind of that same thing. I took a little while to call him back and lost a really good agent opportunity. So in the same way, like we can't take it for granted. If you have a hot lead, make the call.
Yeah.
Right. So that's another thing to learn. Did you have another thing?
Oh no, I thought we were moving into the second part of the question here. So
yeah.
So the second part of the question is, what steps can I take to prevent such occurrence in the future?
Yeah, and I think that's what we would have done different for you. I think that since we don't know how you did things before, when we recommend 30, 60, 90-day calls. And so calling once a month for the first 3 months, and then maybe at the 6-month mark for a brand new customer. So if you just enrolled them and then you didn't talk to them again until next October, and then you find out that they went with someone else, can't be mad at that. Right. Yeah. I mean, that you have to build a relationship with people, and you have very small amounts of time to do that. That time is during the first appointment. Did you create a good relationship? Did you let them know that they were important to you, that you'd be there for every situation that could come up? Did you set expectations? Say, I would like to be the first call that you make. Did you do all those things? Then did you do the follow-up calls afterwards? Hey, did you get your ID cards? Have you started using, taking advantage of the gym? Have you found a dentist yet? Those types of things. And then the 60 days, how's everything going? Just checking in. Never want to bother you too much, but just wanting to follow up, and then call again at the 90-day mark, then at the 6-month mark. If you would have done all those things, you think that you might have had a stronger relationship, or maybe they were telling their sister that they need to come with your agent. Yeah. I don't know all that went on there, but that's that I would ask an agent, if they were sitting in front of me right now, like, did you do all those things? And if the answer was yes, I did, then sometimes that just happens, right? But if it's no, I didn't, I probably should have. Well, maybe that's a learning experience, is that we are in a relationship business. We're not just in a business where we're signing people up and then talking to them next year.
Yeah, I love that response. I think some thoughts that I have on that are, especially in that initial appointment, right? You're pouring the foundation and you're auditioning for these people, because they can go and shop anywhere. They can go online and enroll. They can go with another agent and pick the exact same product that you're presenting to them. So you have to find a way to stand out and really build value in yourself. And that happens in that initial appointment, but ongoing, like you said, 30, 60, 90. But you want to build so much value in yourself and everything that you're able to do for them as their agent. So that way, like you said, they're telling their sister, you should be calling my agent, instead of it happening the other way around.
Yeah, absolutely. Let's go on to the next one. And this one I think is good for you. How do you determine if someone is better off staying with their group health insurance plan versus just making a change to a Medicare Advantage or Medicare supplement?
You've got to do a cost analysis. So you want to sit down with this individual and figure out if it makes sense. There's a lot of questions that you have to ask to find out what makes the most sense for the individual. And at the end of the day, remember, as an agent, it's your job to advise them on what's best for them. And sometimes there's going to be situations where it does make sense for them to keep their group insurance. And so giving that advice is going to lead to referrals. So you may not have gotten the sale in that initial meeting or appointment with them, but it is going to lead to sales for that individual down the road, because they're probably going to retire at some point. But it can also lead to some referrals. So I met with somebody who turning 65 and they're still working, and they reach out to me and say, Oscar, I'm still working and I have insurance through my work, but I'm turning 65. I hear that there's a penalty. Do I need to sign up for Medicare? And so my response was, well, that depends. There's a lot of factors that come into play that will determine whether or not it makes sense for you to keep your group insurance or not. Let's set up a time to get together and we can go over everything and explain how everything works. In the meantime, can you do me a favor? Can you find out, if you don't know, how much it is that you're paying for your insurance at work? And do you carry any dependents on your insurance? Is your spouse on your insurance? Do you carry any of your children? Are they still on your insurance plan? Because those things matter. And then when I come over, when we get together, can you do me a favor? Can you have your medications ready to go, so that way we can check? And there's a reason why I want all this information, and I can do a better job of explaining it when we get together, when we have our appointment. And so then it just comes down to doing that cost analysis, comparing the cost of Medicare to what they're paying through their group insurance. If they're carrying a spouse who's 62 years old and they're still not eligible for Medicare, well, what happens to my spouse? If I take my Medicare and come off of my group plan, what's going to happen to my spouse? Well, in that situation, it might make sense for you to stay on your group insurance until your wife comes of age, or you can look at alternative options. There are ACA plans. They can go onto a marketplace plan if that's something that they're willing to do. Many times I've found that they're not, at least in the market that we're in, people would rather keep their group plan than go onto an ACA plan. Now, if it's just them on the plan, nobody's on there, then now let's look at how much you're paying to have this plan. What's your deductible? What do your co-pays look like when you're seeing doctors, when you're seeing specialists? What does it cost for your medication? So I can go on and on, right?
No, it's good.
It's kind of a little bit of a deep dive. It's not as easy as, yes, I have insurance through my work. Should I keep it? It's not a yes or no answer.
So let me go ahead, and I'm going to ask you questions. Is it worth setting up an appointment? Someone tells you they're going to continue working until they're 67 years old. They want to set up an appointment with you. Is it worth your time to set up that appointment?
100% of the time, the answer is yes.
Okay.
It's always worth it.
So that's step one. Okay. So I want to because there's different situations, right? So if you meet someone like a company where they have 10 employees and let's say they have 25 employees. Okay. So that means that Medicare pays first. And then the plan pays and then Medicare pays, right?
Right.
Okay. So in that type of situation, they have a $6,700 deductible. Mm-hmm. It definitely would make sense for them to leave that group insurance. Maybe they're also paying $200 a month for it.
Right.
It makes sense for them to leave. But I want to give you the other option where somebody is on a Medicare Advantage plan, and they're on their group coverage. And so this situation just came up. So person's turning 65. They called me up. I want you to look at it. I want you to tell me. I was like, man, I have a feeling. They work for the county. I was like, I have a feeling we're not going to need to meet. But I was like, let me just, can you send me your insurance? Let me just get a look at it. And so they sent it, and they had a $50 deductible and like a max out of pocket of like $800. I knew it because they work for the county, right? Like that plan was a really, really good plan. And all they're they take all brand medications, and like the copay is like $35. So clearly we know that they don't. So I didn't take the meeting on that time.
Yeah.
But for the most part, if they give me an indication that they work for like one of these really large companies that does a great job of taking care of their clients, a lot of times, like there's a big company here based in San Antonio. It's called USA, right? A lot of times their group insurance is putting them in a better situation than really any kind of Medicare Advantage or Medicare supplement that I could get them on at this time. And what I would usually tell them is, if they call me and say, hey, I work at USA and this is the coverage that I have, usually I'm probably not even going to have that appointment. I'm not going to set it up. But if they're working for a smaller company that I've never heard of, then I would. So it just kind of depends on the situation. And like Oscar said, you just want to go through, but it's definitely definitely worth your time to look at, right?
Yeah.
You know, when people are first turning 65.
Again, these people, they're not insurance experts. They're wherever it is that they work, they're probably doing something that's not insurance related. And so it's our job to make sure that we get them the information that they need. So you had that, you know, you got that phone call from the county employee who had that rich insurance plan. I got a similar phone call recently. This person worked for a car dealership, big car dealership, and he's paying $150 a month for his insurance, but he's got a $6,000 deductible. And so he's out of pocket until he spent $6,000. So with his doctor's visits, if he ends up in the hospital and whatnot. So question is, well, if Medicare is going to be costing me $174.70 next year, shouldn't I just keep my insurance through my work? That's $150. It's $20 less. It's like, well, no, let's sit down and let me explain to you what's going to happen when you go to the doctor, if you need an MRI, if you need some kind of surgery, if you end up in the hospital, this is what's going to end up happening with your insurance now versus if you take Medicare and a Medicare Advantage plan, or if you've got the budget for it, you can pay a little more and get a Medicare supplement that's going to cover a lot of these things with very little out-of-pocket costs. So again, it's important just to have the conversation with them and get the information out to them so that way they can get a good, clear understanding of what their options are and then help them make a decision.
Yeah. So we're going to go ahead and wrap those up for today, but really just kind of want to remind everybody why we're in the Medicare business and just encourage you could change people's lives. There's a lot of people out there who don't realize, first of all, they might just be on original Medicare, right? And they see that they have a deductible and they haven't gone to the doctor for years because they've got to pay 20% of everything. And then you connect them with the Medicare Advantage plan. You could save somebody's life, right? Mm-hmm. Someone who ends up going to the doctor and then they get their physical and they detect that there's there's something more that they need to go to a specialist, and then they go on. You could actually have an impact on somebody's life. That's why we're in the business that we're in. We're also in it because we're putting them in situations, especially if, you get that phone call from someone who's paying $350 a month to be on a Medicare supplement. And they're 75 years old and they don't know what to do because they can't make ends meet anymore. And you're offering an Advantage plan and you're able to bring down those costs. That's why we do what we do. Is that right?
It just feels so good to do what we do. I think in this line of business, you meet with people who they're struggling and they just don't understand and they're so confused. And so it feels good to be able to go in and sit down with somebody and just explain to them options that are available to them and that are going to put them in a better position. And we're impacting lives on a daily basis. And there's something noble about what we do. And it's a good feeling, right? I go home knowing that the people that I'm meeting with, that I truly am impacting their lives. And so, of course, we do this to make money. This is how we make our living. But the reality is, if you put people first, and this goes for life in general, if you put people first, good things will follow. And in this line of business, if you're putting your clients' needs and what's important to them first, the money's going to follow. The revenue will follow, but put people first. Yeah, there's a book from Simon Sinek, The Finding Your Why. And I can't remember that's probably exactly not what the title was, but it's something along those lines. We'll put it down. With why? Yeah, start with your why. And realistically, obviously, there's lots of ways to make money, and we do. That's our goal, is to make money, right? But the reason, the why of why we want to do this is, man, if you can make it that your heart is to help other people, then that comes across, and people are going to want to work with you. They're going to want to have you as their insurance agent. So until next time, thanks so much for watching. We want to remind everybody we have social media, and we have Instagram, we have Facebook, we have TikTok and YouTube, and so we'd love you to follow us there. Also engage with us there and ask any questions. That's what we're here for, is to help other agents to be successful. And share the show. Absolutely. So until next time, thanks so much.